publication of IPS Karnataka chapter. As we are all aware, we are at the verge of our first journal, which was yet to be released, and probably we are looking at February 2022. And as a prelude to this, we have been conducting a series of activities. And today, one such activity is discussion on basics of peer review. We know that peer review has been very, very important since time immemorial. From the time it is officially recognized more than about 300 years ago, it is still said that the linchpin about which the whole business of science is pivoted is the peer review. So to go through this program, this will be the flow. I'll be introducing the panelists for the day and the chairperson. Chairperson Dr. Ashok MV will try to give a small set induction, followed by a small 15 minutes talk by Professor Anand Pandurangi K, followed by Professor Janardhan Reddy, and then it will be an interactive questions by the audience or by myself. I request all the audience to put their question in the chat box so that we can proceed with it. I'll start off by introducing Dr. Ashok, who is the chairperson for the day. He is the professor of psychiatry at St. John's Medical College Hospital and also the head of CARE ADD. He completed his MD from NIMHANS. He was a visiting registrar at Liverpool, UK between 1993 to 94. His areas of interest is child mental health, and he has been heading CARE ADD, which is a Center for Advanced Research and Excellence in Autism and Developmental Disorders, along with St. John's Medical College. He has developed a scale to screen for ASD in 9 to 18 months old and has carried on various research studies in this area. He is currently the chair of IEC at NIMHANS Bangalore. He is the hub director for NIH FIC grant and is also actively involved with Minds newsletter since its inception. I welcome you to the program, sir.
Thank you, Dr. Kiran. Pleasure to be here.
Thank you, sir. The first panelist for the day is Professor Anand K. Pandurangi. He is the professor, director schizophrenia program, director brain stimulation therapy program, a division of inpatient psychiatry from Virginia University. He graduated from University of Madras way back in 1975 and MD from University of Bangalore in 1978. His special areas of interest include schizophrenia, bipolar disorders, psychotic disorders, and major mental illness. And he has various publications both in national and international fora. I welcome you to the program, sir.
Thank you.
We have with us Dr. Y. Janardhan Reddy, is a professor of psychiatry and currently head Department of Psychiatry and OCD Clinic at National Institute of Mental Health and Neurosciences, Bangalore. As we all know, the special area of interest is OCD and bipolar disorders. He is also the reviewer of many national and international journals in psychiatry. He was awarded the Visiting Commonwealth Research Fellow at the Oxford University Department of Psychiatry. He is also the prestigious winner of Sir C.V. Raman State Award for the Young Psychiatrist for the year 2011 by Government of Karnataka. He is member of Enigma OCD Working Group and is also the current WHO Working Group, member of WHO Working Group on OCD for revision of ICD-10. He is the lead author of Indian Psychiatric Society Clinical Practice Guidelines on OCD and CBT. I welcome you to the program, sir.
Thank you.
So with this, we know that the concept of peer review has been in the forefront for more than 300 years, but it is no short of controversies. And we know certain of these issues where the whole concept of scientific publication was questioned. To discuss in further about these issues of peer review, I would like to call upon our chairperson for the day, Dr. Ashok, to start with the proceedings. Over to you, sir.
Thank you, Dr. Kiran. I'm not sure how clearly my video is coming across online. I apologize for finding myself on the road. I thought I'll be home and logging in from home. I just
it's clear.
It's clear, on the road, sir. At 7 p.m. Yeah, thank you. Yeah, so it's a pleasure to be in this program along with Professor Anand Pandurangi and Professor Janardhan Reddy. The Journal of Psychiatry Spectrum, the Journal of Karnataka IPS, it's an idea that's got mooted over almost 20 years plus ago. And gradually a critical mass of support has kind of evolved for it, and it's nice to see it all coming together. And these lead up programs being organized by the editorial committee is something very it's something very exciting to be part of. It's something very it's a very nice way to kind of really lead up to the launch of journal. So it's a very nice program. Just a few days ago there was a discussion on ethics, and now the discussion about peer review. It kind of sets the stage and builds significant momentum for everyone to look forward to the first issue coming up in a couple of months' time. So a great job by the editor and his team. Congratulations to you all. It's a great pleasure to invite both Dr. Anand Pandurangi and Dr. Janardhan Reddy. I mean, eminent clinicians, scientists in their own right, who are both who probably are extremely aware of the peer review process and can share their words of wisdom with the audience today. I wouldn't take too much of your time. I was not very clear who will be speaking first, Dr. Kiran. It'll be
Dr. Anand Pandurangi will be speaking first, sir.
Yeah. Okay, so to begin with, Professor Anand Pandurangi from Virginia, USA would be speaking to us. Thank you for joining us so early in the morning there, Dr. Pandurangi. Over to you.
Hello. Yes. So, good morning, good evening to everyone. It is my pleasure to be a part of this program. It is quite exciting. And when I think Vijay asked me about it, I was delighted to say, yes, I would like to do this. I am also pleased to know the people on the panel. I think excellent, a lot of seniority, a lot of experience is there on this panel. So some of the things that I am going to talk about are going to be rather broad in nature, because the title is like the basics of the review, and we won't be going too much into the depth. I know there was or will be one on ethics, for example, and there may be others. I think there is one on statistics. So I will just be touching upon some of it, but not go into the depth. And also we want to allow, I suppose, a good amount of time for interactions, questions. And so I will limit myself to about 15 minutes plus minus. And let's see how that goes. Of course, in addition to what was said about me in the introduction, I have rather close connections with various Indian institutions. Very proud of that. When you say a University of Madras, actually my studies were in Jipmer, Pondicherry. And when you say University of Bangalore, of course it was NIMHANS that I did my MD, where I also was faculty for a short period of time before I left for USA. And then I have been a visiting professor to PGI for many years in Chandigarh, and a couple of other private universities as well, where we have done teaching sessions, etc. So I just want to highlight my continued India connections over the last 40 some years. Anyway, so coming to the topic, the review is critical. You will see that almost any announcement that is made on any scientific finding of extreme public importance, let us say COVID-19 or a cancer breakthrough, will always, when the newspapers, when the professional society newsletters announce these things, even on TV, they will say, but this has not undergone peer review. to publish it or modify it or reject it, then until that process has taken place, the findings are to be questioned. They are not to be taken as the ultimate final findings, because many times it's important to announce these things to the public because of the public health importance or some other importance attached to it, but they are not really to be accepted by anyone, including the scientific community as well as the practitioners, unless it has undergone peer review. So that I think all of us understand the importance of peer review. The reviewer needs to keep in mind a number of different things. It's a balancing act. The job of the reviewer is to first and foremost verify the scientific validity or content of the article. Is there validity to what is being said, what is being claimed, what is being concluded? And is there does the content support that? So that is the primary purpose of review. However, there are other purposes also. And that is this an appropriate article for this particular journal? So the content may be very good, the content may be valid, but is it appropriate for our journal? That has to be also looked at very carefully, because the article will be published in a journal. There is a certain readership for each journal, and not every article is appropriate for every journal. And so we have to be mindful of that. If someone is going to be writing extensively about public health and epidemiology, and the audience consists primarily of general practitioners, general psychiatry practitioners, then every single detail and tables and all of that may not be relevant for that purpose per person. He or she may not even have the time for all of that. And so the journal then is not serving the right purpose. So the reviewer has to see, is this appropriate for our journal, for the journal for which I am reviewing? I review for about almost 25, 30 different journals all over the world. Journals coming from all over the world. I'm a reviewer for many years for many of these journals, and I review a good 40 to 50 articles every year. This is one of the things I have to look at each time. The article that I'm reviewing and the journal that has asked me to review, is there a match between the two? There is another purpose that is not typically mentioned, and that is support. The reviewer cannot be a strict parent or a strict instructor or teacher or professor. If we did that, we will be discouraging, especially the younger authors, that there is no way I'm going to be able to publish, so why bother? So the reviewer should be somewhat generous and kind in his approach, while paying respect to the other two goals of scientific validity and appropriateness to the journal. We have a role of also nurturing the investigators, especially the younger ones. So in my typical review, I will actually provide some suggestions. I'm not usually harsh in my criticism. It's easy to be harsh. It's easy to be rigid and harsh and say, this whole point is totally useless and it is highly unsupported by the contents and the sample size is extremely small and just let's reject it. That's quite easy to say. But we should be thinking about what will happen to our potential authors and investigators. So there is a role, as far as I'm concerned, for the reviewer to be also supportive in a way and make some constructive suggestions so the article becomes better and more suitable for publication, and provide some encouragement to the authors to work on it, to modify it, to add data if necessary, etc., rather than to rigidly and strictly reject, make a recommendation of reject. Going from this, so that has to be always kept in mind by the reviewer, and reviewers also, I think we all develop over a course of years, just like anything else. We mature over a period of time. I might have been more strict and more black and white when I first became a reviewer 30, 40 years back. And now I might be much more kinder to the authors, saying that I've been there, I've done that, I have made the same mistakes. I have, been helped by healthy, constructive reviews. So I should also do my part. The second thing the reviewer, I think, should do, so that's about the first point. The second main point I wish to make is read very quickly, glance at the entire article first. Don't go paragraph by paragraph, line by line. And of course, we are going to find a lot of things that need improvement. But I strongly recommend that very quickly read through the abstract, look at the title, abstract, and take a quick glance at the entirety of the paper. That will tell us whether some of the things that I'm going to say about paragraph 1 are actually addressed somewhere else. They may be addressed in the discussion. They may be addressed in conclusion. And so the suggestion then would be this needs to be moved up to the introductory section rather than, gee, you didn't cover this. And then you go back and say, oh my God, he did cover it, but it was in a different section. And so you have to revise your review. So I recommend to the reviewer, read the whole article quickly. Then we start with the details of the review. The title is very critical. Many times when we do our literature searches, you will know that we accept or reject articles for our own reviews, for our meta-analysis, and so on, more or less based on the title. And I'll say something similar about the abstract. Because when I put in some keywords and search words, and I get 8,000 hits, I am not going to be able to review all 8,000. They aren't going to be appropriate for my purpose. I'm going to be looking at the title. And does the title convey what I'm looking for? So the reviewer needs to understand the importance of the title. The title has to be succinct and short. It cannot be a long title. I cannot write an article saying enlarged ventricular size in patients with chronic schizophrenia in a state mental institution compared to a university hospital in the 1970s. I cannot be writing an entire paragraph as my title. I should simply be saying ventricular enlargement in schizophrenia. And that should be sufficient. It's succinct, it conveys the main point. So did the authors provide a succinct, appropriate title? That is the next item for the reviewer to look at. Is it short? Is it brief? Is it succinct? Does it convey the purpose of the article? You have just glanced over from the beginning to the end of the article. You know what it contains. And is the title appropriate? In my opinion, conclusions should not be claimed in the title. That is not appropriate. One should not somehow suggest that the point is proven by using a title of that kind. ventricles are enlarged in schizophrenia may not be the best way of writing the title. Then we go to what I think is the most critical part of an article, namely the abstract. Again, for the reasons I mentioned, that is, many readers depend on the abstract. We don't have time to read an entire article and find, excuse me, and find out that that's not something for me. That's not addressing my questions. That is not for my area of specialization. We depend on the abstract. Abstracts are usually about 250, 300, 350 words, and they have to convey this. Now, you mentioned in the introduction somewhere that the peer review process has been there for hundreds and hundreds of years. I will mention here that it is not hundreds of years, it is actually thousands of years. This whole process of writing, especially if you look at the ancient Indian literature, you'll find something very interesting. They have a shloka in the very beginning of the write-up, in the very beginning of a book, even if it's a very big book, even as big as, say, Mahabharata. You will find a shloka there in the very beginning that summarizes the content. Excellent, very nice. You can, and that is the purpose, that is the abstract. That is the first shloka is the abstract. Likewise, they have a conclusion, by the way, called the Mangala Shloka, and at the very end, and that is their conclusion. So this tradition of having an abstract and having a conclusion has been there from ancient times, and the reviewer should pay a special attention to the abstract. Does it convey the entirety of the article in a succinct, short, brief fashion in the number of words that the journal allows the authors to write it in? So that is something to be kept in mind. And you can score it on these points as you go. You know, okay, title is appropriate, I give 1 point or a check mark. The abstract is about 300 words, good. It seems to convey the totality of the meaning of the article that is being submitted, good. Or no, the abstract is totally off the mark. The authors are very confused. Many times this happens quite frequently, I should say, that they start writing details of the statistics in the abstract, and that is not the place for that. And they write long controversial conclusions in the abstract. That is not the appropriate place for that. That has to go into discussion, not in the abstract conclusion. So following that, we move, let's see, I don't know when I started talking, but I'm assuming I have about 2-3 minutes left, 3 or 4 minutes.
Yes, sir. Kindly carry on.
Following that, you go to the actual body of the paper. A good article should have a solid introduction, or sometimes called background or introduction. The topic of investigation has to be introduced by the authors as to what is it. If it is psychopharmacology of depression, there have to be about 2 lines about depression. Why is it depression or major depressive disorder is a worldwide illness of approximately 7 to 8% annual prevalence and 15, 16%, 20% lifetime prevalence, of which approximately 30, 35% are refractory to several lines of medication and even combination of psychotherapy. Has to be stated before you go on to say, why am I investigating and reporting on a new treatment? What is the necessity for that? So that is introduction. The other thing I like to see personally in the intro is a history. 1, 2, or 3 lines of the history of this particular topic. If it's antipsychotics, I'd like to see that the first antipsychotic came around 1948, and we have about 70 years of experience using specific antipsychotics. Paying some respect to the people who did the pioneering work and acknowledging that this work has been done before. I'm not the first guy to be doing this. I think not shows the humility of the authors also, but more importantly, their knowledge of the field. And so again, it doesn't have to be in any great detail. It has to be just 1, 2, or 3 lines. So that is the introduction. Then you go to the start reviewing the actual article. Is the purpose stated clearly? Are the aims stated clearly? Those of you who write grants understand this very well. NIH here has a very specific format in which grants have to be written. The aims are a very critical part of that. When I teach residents and young faculty, when I mentor them about this, I also ask them to include their hypothesis into that. That is, the aims should reflect your hypothesis. So are the authors doing that? Have the authors done that? So that has to be looked at in terms of the review. Then you go to the methodology, the design. How was the study designed? Many people skip this. And especially I've seen this European authors, they don't tell us what's the nature of the hospital in which they are doing this study. They don't tell us that they're using samples from 3 or 4 different hospitals. I have to ask them in my review comments, like, it's not at all clear to me whether this samples came from a single hospital in a city's urban setting, or this is coming from 4 or 5 different hospitals in different locations. They just skip that for some reason. And so one has to go from aims, including something about the hypothesis, to methodology, and that should start with the design of the study. And what is the context? What is the location? Where is the sample coming from? Is this a sample of convenience? Is it a random sample? Is it a consecutive sample, etc.? So again, I won't have time to go into all the details. We can discuss that in the interactions if people have questions. Then you go to the findings. Or maybe if there are lots of instruments or radiology, imaging, you describe all of that. So has that been adequately done? Is another question the reviewer has to look at. Then you go to the findings. And are the findings presented in a succinct fashion? Are they presented in a tabular form? Are the tables and figures appropriate? Is the narrative too detailed and the reader might get lost in reading all the little numbers and miss the main point, like counting the leaves and forgetting the forest, or counting the trees and forgetting the forest? Is that happening here? So the reviewer has to look at it from that point of view when it comes to the findings of the study. Then, of course, is the statistics. We said there will be another session. Again, we can go back. This is another big deal. The biggest thing that I find is people forget to make corrections for multiple analysis. Almost always, 70–80% of the times, I see that they do not make the Fisher rates correction for doing 100 different correlations. And that is really unacceptable. And so also, are the tests two-tailed or one-tailed? If you don't know what exactly you're going to find, it should always be a two-tailed analysis. It cannot be one-tailed. That is assuming somehow you already know the findings. Only if you're doing a confirmatory study, then you can be going for one-tail. So those types of things have to be looked at in terms of whether this is going to be a good article and valid from a scientific point of view. Then the discussion. The discussion is not simply a repetition of what has already been said. The discussion has to be discussing the main findings in the context of other people's findings on the same topic. While this was found to be the case in studies from South India, our study seems to slightly disagree or is unable to replicate that. We are finding the prevalence is somewhat higher in women rather than equal prevalence in men and women or whatever. Our rates of response to this medication seems to be much less than what is reported so far by our predecessors. So the discussion has to be about your findings in the context of findings that already exist. So have the authors done that? And of course, then we go to the conclusion. Like I said, just like the abstract, this is also critical. Many of us jump directly to readers, jump directly to the conclusions to see what was concluded. And the number of articles that come at us is simply unbelievably high. There is no way you're going to read every single article, especially those that have a lot of technical detail. So we look at the title abstract and we jump to conclusions. If that's what the average reader is going to do, then we, the reviewers, have to be sensitive to that and look at, is the conclusion justified? Is the conclusion valid? Is the tone of the conclusion sober, humble? Are people, authors, claiming something that they did not show or they did show, but it's not sufficient to make such a tall claim? All of that. So I will stop here. I know there is at least one other speaker, I think Dr. Reddy, and then I know there will be some time for interactions and questions, so more issues can be covered in that. So I just wanted to give you my thoughts on the review process. Again, thank you for the attention, and I will wait for the other speakers, and then I'll be around here for the interactions. Thank you.
Thank you, sir. Thank you for running through the process of peer review, from taking into consideration the validity, the appropriateness of the content, and also a guideline that the reviewer need to be mostly supportive rather than being very, very critical. With this background, I would now request our next speaker, Dr. Y. Janardhan Reddy, to go ahead with this presentation. Just a small announcement. Any questions, any comments, any discussions, kindly drop in the chat box after the session. Then we will go on with the questions and the moderation. Thank you.
Thank you, Dr. Kiran. I'll just share my screen and then maybe begin. Where is it coming? Wait.
Share screen.
Share screen, but I'm trying to see where is the. I think they're visible now, right?
Yes, it's visible now, sir.
Thank you, Professor Pandurangi. I think that was a very nice introduction about the peer review process. In fact, I'm quite glad that because you have addressed an aspect of the peer review process that I did not include in my presentation. Most of us know that Professor Pandurangi has summarized succinctly what we routinely teach our residents when they present an article in a journal club. In a sense, he actually summarized how to read an original article critically. Now, it's just that in journal club, you do that post-publication, but if you are called in as a reviewer with an expertise in the area, you do it before the publication. Make sure that the published research is valid and is a good quality paper, and then it is original. In a way, peer review process, it excludes or weeds out poor quality articles, invalid articles. So that's the very purpose of peer review. So let me go through quickly some aspects I thought would be important from the point of view of reviewers for a journal. Now, peer review is at the heart of the process of publishing in all of science. It's not like something which is very unique to medical sciences or to, science. In fact, not even to science. I mean, most scientific publications in any area go through a peer review process. I happened to read this peer review article by Richard Smith. He was an editor of BMJ some time back. He said that, there are many reasons why people are unhappy with the review process, but it is like being unhappy with the democracy, but then it's a system with problems, but still it works, and probably is the least bad one we have at the moment, because there's no substitute for a peer review process. Because even after article is published, it goes through another set of reviews as and when people start accessing the article and read it. So it's a continuous process, but then to make sure that it's of certain quality before it goes into public domain, then it has to be obviously reviewed by people who have an expertise in the area and who can vouch for the validity of the scientific article. So sometimes it can be highly subjective, unreliable, and inconsistent process, but then there's the process that we have. So I will just come to the more practical aspect. Who is an ideal reviewer? Now, to my mind, ideal reviewer, most important thing is that you should have necessary expertise or experience in the area. Now, who is the one who has an expertise and experience in the area? It's fairly subjective. But if for someone who has been working in, say, schizophrenia field for the last 25 years, then obviously you are a person with expertise. Even a person who has been working for a couple of years also can have an expertise. But then it's always good that a reviewer has a track record of having worked in the area and is familiar with the research in the area. When I say familiar, it is better that the reviewer also has done research himself or herself before one becomes a reviewer. Now, it's very important because it's not research is not a black and white. There is no perfect article. There's no article which has everything that we want. So a person who has done some research in the area, who knows the field, has this ability to identify whether a particular research can contribute something to the knowledge, despite some weaknesses and limitations which are inherent in most of the research that we do. Like I said, there's no perfect research, but an inexperienced reviewer who has no idea of how it works. For example, we sometimes see in our journal club a very bright MD student first time doing a journal club, even if you get the best article in the world, and if you have a equally cynical chairperson, they find everything wrong with the manuscript and nothing right with the manuscript. Now, that is really being what Professor Pandurangi was talking about, being unfair to the science, because we always contribute to science in small bits and pieces. It's not an aha experience that you come out something extraordinarily different every time you publish a paper. So it has to be, a reviewer has to be unbiased and has no conflicts of interest. For example, conflicts of interest can be financial, it can be personal, professional, it can be anything. But most journals ask you to declare that you have no conflict of interest when you are reviewing a particular article. Now there are various models of peer review. Now, single blind, this is the method that most journals, at least the top journals in psychiatry, employ, where authors are blind, but the reviewers are not blind to who has done the article. Double blind, sorry, U is missing there. Double blind is where neither the author nor the reviewer know each other. Now, the double blind process, for some reasons, although many journals employ this, is also gone out of fashion because, after some time, is difficult to guess where this article comes from if you're working in an area. And then sometimes knowing who the reviewers or authors are all also helps us to find out the quality of the work indirectly, or maybe even sometimes identify the conflicts of interest and other problems. So I think many journals have done away with double blind review process. They are mostly comfortable with single blind. I myself don't think double blind always adds to the quality, but then there can be different views about it. Then there are open kind of reviews where the names of reviewers and the reviewers are published. Then there is another method called transparent review, where the review is published, but you don't get to know the name of the reviewer. Then, of course, there is a post-publication open peer review. And these days, you can have a preprint commenting shared on preprint archive or a server. And there are some journals who are willing to port the reviews if they are publishing a group of journals. For example, if you publish send an article to Indian Journal of Psychiatry and then you reviewed it, but then editor found that it is better with Indian Journal of Psychological Medicine or some other publication of the same group, they ask you whether they can port the review, because that actually does not waste the time of the reviewer and also the editor. So you can optimally utilize the scarce resources we have in terms of reviewing scientific articles. Then I will come to ethics of peer review. I think this is very, very important when review is being done. It should be unbiased, independent, and critical assessment is an intensive part of review process. Fairness, When I say confidentiality, why is it very important? Because it's a privileged communication between you and the editor. It's not available in public. So a good reviewer is someone who does not share the content of the manuscript with anyone unless he or she wants to take an expert opinion of another colleague or wants to take the help of a junior colleague who he needs to train. But this has to be done with the explicit permission of the editor of the journal. So it's very, very important that confidentiality is maintained and there are no conflicts of interest, and then full disclosure is encouraged. Then there are certain important don'ts of a peer review. I think these are very, very important to me. One is, of course, I mentioned about violating confidentiality. I see many times people talking about how they got articles or reviews from some group or the other in the world, and then how they've done a bad, work. This is something which actually damages the reputation of the reviewer, and also the whole process gets vitiated. Now, doing favors to authors, believe me, this is not unusual. It's about I scratch your back, you scratch my back, and this exists in scientific world, and we are the same people like anybody else. So to be very, very careful that are we doing any unnecessary favors to authors because we know them, they're my friends, or that we have some collaboration coming up next. All these factors can play a role. Then the other thing which can sometimes happen is appropriating authors' ideas even before the manuscript is published, and then you sometimes deliberately delay the review process. Your paper gets published earlier if it's a similar paper than others. Then deliberately providing negative remarks or highlighting negative points about a manuscript with the intent of obstructing its publication. Or the other important thing is, in fact, these days, some journals warn you that not to contact authors directly. If you have some doubts, you write to us, or maybe you can write in the review itself. Don't contact the authors. Then you can involve others in the review process, particularly young researchers who want to learn how to do it, but this should be done with explicit permission of the journal. Making hostile, inflammatory, derogatory, and personal comments and accusations is strictly no. I can tell you, when I started actually publishing maybe 2 decades ago or more than that, sometimes I used to be very hurt the ways I used to get some reviews. I still remember I sent an article to one famous journal, and then one of the reviewer made one sarcastic remark saying that, oh, in India, you give SSRIs to children. Oh, then now I wonder what the quality of the manuscript is all about. So it is a kind of, sometimes without your knowledge, you can make these kind of an accusatory remarks, or that, sometimes you make very sarcastic comments about the language in which the paper is written. So be very, very careful that we are actually evaluating the manuscript. We are not evaluating or judging the authors when we review a manuscript. So, and the other thing which many times authors do is that they suggest their works to be cited in our article. In fact, there are times when journal editors cite you after paper is accepted. Those 2-3 articles have been published in our journal. Why don't include them? I have come across this many times from reputed journals because they have to enhance their citation matrices. So this also strictly no when you do a peer review, unless you think that your articles are relevant for the paper that's being reviewed, not just because you have published an article in that area. Okay. Now, what important is when not to accept review invitation. Now, if you are currently employed in the same institute, same department as the other, sometimes it is difficult to be fair and objective. They may be some of your friends, you meet them every day in the canteen. I don't know. This is very subjective, but I would probably, if I get articles review from my own department, I tend not to review them. And particularly if I've been a recent mentor or a mentee, you have a close professional collaborations, you have a joint grant holder, or your work is similar to the manuscript work is similar to yours, that is in preparation or under consideration elsewhere. I think it's best not to really review that particular manuscript because you may not be all that objective in the end. And most important, if you don't have time, simply don't accept to review the article, because most authors want reviews on time. And believe me, all the reviewers are also authors. We have gone through that process ourselves. And when we get a review 2-3 months later, we get really frustrated. So it should be very, very clear that we don't really accept and we cannot do it. Maybe you can suggest alternate reviewers if you think somebody else can do a better job. Most important to me is that if you think you have no expertise in this area, then don't accept it just for the sake of, you want to be recognized as a great reviewer for all big journals. So don't accept, because sometimes I'll tell you the articles which come from some top journals like biological psychiatry or molecular psychiatry. They may be in your area, but sometimes the technology or the techniques that are there in the paper may be simply Greek and Latin to you. Why do you want to review it just because you have been working in that area? So I think we have to be very honest with ourselves as to whether I can give a good account when I read a paper. How do we write a review? Best practice is to refer to the manuscript. Don't keep referring to in the review as authors. I always keep referring to the work as a manuscript rather than talking about authors. Be constructive, honest, and be polite. It's is a nice idea to use suggestions to improve the quality of the manuscript. Let me tell you, I've been publishing for 25 years, and I also came across some research that more than 90% of the authors feel that after the review process, the quality of the manuscript has actually improved substantially. And I fully subscribe to it that, when I get reviews from others, I can improve my manuscript because they see it from a different perspective. I know of friends who send their articles to some good journals just to get good reviews and to learn, how they can improve the manuscript. So I think there's a great merit in taking suggestions of the reviewers. It improves the quality of the manuscript. And then when you actually reject a paper, more than anything else, I think there should be clear reasons for rejection rather than, making even non-specific comments and then simply say rejection is quite disheartening because authors need to know why you are rejecting or what kind of revisions you want actually from them. So summarize the paper in 2 or 3 sentences. That's a good way to begin a review. All articles, most articles have some strengths, identify strengths and talk about them. I usually review section wise. How is the introduction? How is the method? Is statistical analysis good? Have they concluded well? Like Professor Pandurangi said, in statistics, I would like to see whether, they are corrected for multiple comparisons and so on and so forth. I usually send reviews section wise, though it is easier for the editor and also for the authors to make some decisions. And I usually have sections like what are the major concerns I have, if I have any, and what are the minor concerns. So authors know that the major concerns which they need to address rather than minor concerns, which of course they have to be addressed as well. Then we can comment on methods and statistical analysis. And it's also important that we comment on the quality of writing because clarity of what we write is extremely important. But make sure that these days we get a lot of articles written in English by people in whom they may not be very proficient in English language and that may not be your mother tongue. So I think, but we should not miss the content of the manuscript just because the language is not good. We can make polite suggestions as to take help from somebody who is proficient in the language, but avoid making any kind of derogatory remarks just because English language is not great. And all journals now have a space for confidential comments to the editor, but these are usually about some limitations. It's not something that's very, very private that you tell people. The editor, the authors don't know. Many times you really don't have much to tell to the editor other than what you are communicating to the authors. Now, don't forget to inform the editor if you suspect plagiarism, scientific misconduct, or if it is salami publication. So in summary, peer review depends essentially on trust. This is a willing participation of scholarly scientific community who give their time and who anyway don't get paid for any of the reviews. So I think it's all a matter of, a large community of researchers working together to make sure that good quality research is published. And of course, responsible and ethical behavior is very, very important. There is a Committee on Publication Ethics scope, which talks about ethical guidelines for peer reviewers. Of course, there are many other things. In fact, these days, many journals also give elaborate guidelines as to how to do a peer review. I was just coming up across some guidelines which were published in the Wiley website, very, very useful guidelines. I'm sure many other journals websites also give this kind of instruction to reviewers. I will leave it at this so that we can have some.
Thank you very much, sir. Thank you for that wonderful insights into the do's and don'ts of the ethical peer reviewing process. As I said earlier, the forum is open for discussion. And before we get questions, I request Dr. Ashok, our chairperson, to share his comments on the process.
Thank you, Dr. Kiran.
Sir, you're not audible, sir. Ashok, sir, you're not audible.
Thank you, Dr. Kiran. Thanks, Dr. Anand and Dr. Janardhan, for sharing the important aspects of peer review. Dr. Anand in particular spoke about keeping the journal's perspective in mind when the reviewer takes up the task. So one of the key things, I guess the editor would do that work to begin with, but for the reviewer to decide if the content is really for the audience of that particular journal or the main focus of the journal, that's the key point that was made. And of course, he highlighted the importance of being a very supportive person in the whole process. He also highlighted the importance of the title, abstract, besides various other sections. Dr. Janardhan Reddy took it forward to talk about what an ideal reviewer should be like, and he quoted different models of peer review and important do's and don'ts in approaching the peer review process. Thank you. Thanks to both the panelists for this. I'm sure it's kind of, there's a whole lot of questions on minds of people who are gathered here. Let me just start with a couple of questions that have come in the chat already. There's one of them says, what are the basic differences between the critical reviewer of a published article and role of a peer reviewer? I'm trying to get my head around that question. Why should I peer review? What is in it there for me for reviewing? Okay, so a critical reviewer of a published article and the role of a peer reviewer. So if the question, Dr. Vijay, would you like to highlight that the specific thought behind that question? The first question is not exactly.
Dr. Janardhan Reddy mentioned about when the article has been published already, we are able to find so many issues in that article. So what is the basic difference at that moment in time and when the person is reviewing before the article is published? Is it the same almost?
Yeah, no, Vijay, I think what I was referring to was something very different. Like Professor Pondarangi presented, that's how you review any scientific article, whether you were a reader of a published article or whether you want to decide whether an article is good enough to publish. Now, the only difference is a peer reviewer has to decide whether the submitted manuscript is of a high quality, is it original, or is valid enough to get published, and in simple language, does it add to the existing knowledge on the field. I think that is something that needs to be done prior to publication. Therefore, some experts in the field, maybe 2-3 people, sometimes if they're top ranked journalists, they send to 6-8 people, and the editor ultimately makes a decision whether this particular manuscript is good enough for our journal and it can be published. Now that is a process, but then peer review continues. The review continues because every time we review an article, we appraise it, isn't it? I mean, that's what we teach in Journal Club. Now, that doesn't stop there, but it's a basic minimum that you ensure before an article is being published. That means it has gone through a rigorous scientific review by experts in the field, and then it comes into open review. Open review, you may agree or disagree with what is there in the article. That is a continuing process in science. So, but the process is similar. Now, when I said there are so many mistakes that you can find, I didn't say mean mistakes. What I meant was, Professor Pondarangi was saying being kind to the people who have done research, because you can find mistakes, limitations in every scientific article that you publish, but you should also be able to recognize its merits and whether it can contribute to the knowledge despite some limitation. I think that's what I meant.
Thanks, Dr. Reddy, for clarifying that. There are quite a few.
Continuing with that, Dr. Ashok, sorry. Continuing with that, my question was, it's just for people when I try, it's a kind of question for inspiration reasons. So if somebody says, why should I peer review? Or they might say, what is in there for me to review? So just for, for information's sake, I thought I want to know from experts.
Dr. Pondarangi, you are muted actually. Dr. Pondarangi, you are muted actually. You need to unmute.
Okay, can you hear me now?
Yeah.
So it's a good question. It should not really come from a new reviewer, but I think it can come from me. This question has now become big for me. Why should I review? What am I getting out of this? Because the number of invitations you get at a certain point becomes too many, and then you have to pick and choose. But the reason for being a peer reviewer, of course, is slightly altruistic. You are part of the scientific community. I'm talking now to the potential reviewers who might be thinking, should I spend some time on this or should I just take a pass on this? You are a member of a scientific community, a professional community, and it is in our interest that all the journals that represent our profession, including the new journal that is being launched, are respected by people who read it, by the larger community, that this is a valid journal. Articles in this are worth reading or worth knowing, or findings in this are valid. And you as a reviewer are contributing to that, to that respect that the profession and the journals have. So yes, we don't get paid for reviewing articles. There are other ways I think they have begun to appreciate or acknowledge our efforts. I think sometimes they will give you some certificate or they publish your name somewhere, your list of reviewers. Everyone knows that. See, at one point in time, and I'm not sure this is a rapidly changing world because the number of journals have mushroomed a lot. At one point, being invited to review an article was an honor. That means the journal editor and the community, the professional community, recognized you as an expert in that field. And therefore, we accepted it as a recognition of our own prior work and experience, and did it with great pleasure. Now, yes, this has changed. This has changed because now there are, instead of 100 journals all the world over in psychiatry, now there are like 1,000 journals, 10 times as many. Every topic, there is a journal now. And so whether that same level of prestige still holds for the reviewer or not, I am not sure, but I still think that one is invited to be a reviewer based on a recognition that, so that is the second reason. This is a recognition of your expertise or your experience or your own work in the field. And so that is the second reason you should accept. The third I mentioned, it is a way of mentoring. It is not a direct way of mentoring, but it certainly is a way. You are contributing to the field in another way by supporting and encouraging the younger researchers by giving your valuable time, maybe 2-3 hours or 4 hours, let us say, per article. But you are helping them develop into good researchers. So there are reasons, like I said, nowadays they have added a few more incentives because I think journals have recognized this takes some time and effort on the part of the reviewer. They've added a few more, academic type of incentives to this. But I don't think that's important. I think the first three things are the more important reasons why one should be a peer reviewer. The other question, let me quickly address, and then maybe Janardhan can take back or others on the panel, namely statistics. Yeah, this is critical. I think Janardhan mentioned about technical details. See, when it comes to these radiological studies and genetic studies, and you are going to find a lot of technical details. You need a lot of expertise to be able to understand and digest it. And not everybody is going to have that. And hopefully the editor has selected 2 or 3. There are 3 reviewers, and one is more like a clinical scholar reviewer who is reviewing it from that perspective. One is more a statistically savvy reviewer who is reviewing it from that perspective. And one is more a technical expertise reviewer who understands, all the sequence, MRI, fMRI sequences and the nuances of that, and is reviewing from that perspective. And the 3 reviews combined together give an informed opinion to the editor how to move forward. But focusing on the statistics part, of course, this is more or less become part and parcel of every article other than some historical articles, right? And so this is a very good question, and I certainly encounter this quite a bit. And what I do is I have a basic knowledge of statistics. I'm not a statistician, but I know t-tests and chi-square tests and multivariate analysis and regression analysis and so on. And in the earlier days, I did a lot of the statistics myself, so I'm a little more familiar with canonical correlations and things like that. So I will apply whatever knowledge I have to that. But if I find this is going over my head, I will simply say so in my review. I will say that there are parts of the statistical techniques used in this review that I am not qualified to review. So please have this section reviewed by an appropriate biostatistician. And I'll just make that recommendation to the editor. Recently, I reviewed, an article from England, and these are things are called as data massaging, data torturing, and so on. And they have literally tortured the data with so many different statistical techniques that you begin to wonder what is the real finding. And so I just wrote that. I said, look, at the face of it, this is an interesting, important study. I don't want to throw it out right away, but the data has been tortured to death, and I'm not qualified to critique the new techniques they are using, but somehow I feel that they are stretching it too much. But please have it reviewed by somebody appropriate. So that's what you do. You do what you can do, and then you tell the editor what you are not able to.
Yeah, I think that pretty much summarizes what you need to do when parts of it you don't understand. There are specialist reviewers, there are general reviewers. Both of them add to the quality of the manuscript, because you might publish an amazing paper, but then there are clinical implications. There's a whole lot to it, just amazing. So you can comment probably on the rest of it, and if there are some technical aspects, ask the editor to get an opinion from somebody else. There are times when I've taken opinion from my colleagues whom I think that they are good in imaging or some technical aspects of it, but I usually tell the editor that, look, I've taken help, or shall I take help? These days, many editors are happy to do that, because an editor doesn't have to find one more reviewer do that. But then it's a good idea that if you don't know, say so that editor can find somebody else. I pretty much agree with the Panduranghi.
Thanks for that, Dr. Anand and Dr. Janardhan. I know Dr. Kiran has put together a lot of questions in the chat box to kind of enliven in the discussion. There's one important thing that he's raised about role of actual training, peer review training and mentoring peer reviewing. Any thoughts on that by both the panelists? In fact, it kind of leads to the other more recent question there about, I think Dr. Janardhan touched upon it, about involving your PhD scholar and so on in the review process. So it's about peer review, training in peer review and mentoring, if both the panelists can comment on that.
Okay, so yeah, this is Anand. I think it would be good to have a more formal process of training. And the reason is, if you submit an article and you get 3 reviews back, you will be amazed to see how different each reviewer said about the same article. Someone will say this article, is slightly outdated, and the findings don't necessarily support the conclusions, and the methodology is not appropriate, and so on. Another one says this is a great article, very timely, adds to our knowledge, excellent. So how can 2 reviewers be so different in their reviews of the same article, same content? And I think that is where the training comes in. And that is why I mentioned the various sections and how to review each section. If everybody followed that, there would be more inter-reviewer correlation would be much better, I would say. So maybe in this case, for jobs or whatever ultimately the name will be of this journal, the editor can send out some rehearsal or training articles for potential reviewers, have them review it, give them some feedback, and help develop a cadre of reviewers who have undergone a uniform set of training and will use a uniform process to review the articles. Now, that is not easy to do for the larger community, but it can be done for a small community of reviewers. And I'm happy to contribute my 2 cents if I'm asked to do that for that process. There are a couple of other questions while I have the mic. Let me just touch upon them, and then maybe Janardhan can take it from there. Is reviewing an article that has already been reviewed and revised. Yeah, and many times that does come back to us. I think all journals ask that question. Do you want to, are you willing to review it again when revised? And so the choice is really to the reviewer to say yes or no at that point. And in my case, depending on my workload, I will say yes. More often than not, I will say yes, because it is easier. I've already reviewed it. I keep my review in a file. I can go back and say, what did I say and what did they do? Usually they share the other reviewers' comments as well. So you can look at it. It's much less arduous than the original review. But if I'm overloaded, I just will say, no, I'm sorry, I will not have time to review this again. You can give it a different reviewer or do it yourself. But the standard is the same. It's just a faster process. You are applying the same filters, same standards to reviewing a revised article. Mostly you are focusing on, is there a item by item rejoinder response by the right authors? Have they addressed what comments you made or another reviewer made appropriately? Or are they able to say, sorry, we are not able to do this? Many of the times we write reviews that say, you need to add data or you need to do this analysis. You never did the medication. You didn't tell us all the details of the medications and the response these people had before you go on to the response to this medication or this treatment or whatever. And then the authors don't like to address that because they don't have that data. They did it from, sitting in their office, looking at a database. They're not actually collecting. This is not a prospective study where they recruited subjects themselves and have direct access to the charts. Many times these are coming from access to some database article. And so they don't have that kind of information. At the very least, they have to admit to that limitation and include that as a limitation, saying that the reviewer has asked for this, but we are unable to provide that information as this article is based on data from a data bank and not a prospective study of patients we collected. And so they have to indicate this as a limitation. And then obviously, if there are too many limitations, the article gets rejected. But if it's only a few limitations, the article can be accepted with the admittance by the authors that there are these limitations.
Thank you, Dr. Anand. Dr. Janardhan, would you like to take on that, or shall I just put down 2 more questions and you can take those? Yeah. I was thinking of a couple of points which may be relevant for the new editor of this new journal to think about. One is, would a level of maturity for a journal, let's say it's been around for a few years and it's got a particular level of citation and so on, would that be necessary for permitting authors to indicate their choice of reviewer? That's one point. And the second question I would like to add there, but question is, when would when a peer reviewer is actually asked to write a commentary, what are his roles and responsibilities? I could start with Dr. Janardhan and then to Dr. Anand.
Yeah, I think the first question you asked is about authors suggesting reviewers, right?
Yeah, that's right.
There's a very standard practice now. Almost every journal asks for at least 3 to 5 reviewers from you. And of course, journals mention clearly that they should have some expertise, but have no conflicts of interest. In fact, some of the journals even ask you whether you don't want your article to reviewed by some people for various reasons, but you have to cite reasons why you want someone to review, why you don't want someone not to review. So I think that choice is being given now. This again is a matter of trust. In the journals trust that you are able to identify reviewers who can critically evaluate your work honestly. I think the whole process of publication depends upon this trust. So I think it is upon us to select appropriate reviewers, but then editors have no obligation to send the articles to the reviewer suggested, but then it actually makes their job a little easier, because editor need not know experts in every possible area that that exists. So I think it is understandable. That's first thing. Second question is about I just lost it.
Yeah, about when peer reviewers are asked to write a commentary alongside the published article, what would be the roles and responsibilities?
Well, I mean, this also many journals ask like a standard question: if the article is published and if you think it's of a great value that requires an editorial, do you want to write it? Yes, I mean, let us say, for example, now somebody has come out with a treatment for COVID-19. Now Merck has come out, Pfizer has come out with it, and then they come out with an article in, let us say, in New England Journal of Medicine. It needs to be put in a perspective. If it is a good enough article, it's a good enough new finding, great finding, then I think reviewer can also write a commentary on that. It's very commonly practiced in many journals, and I don't see it as a problem. In fact, it can be encouraged, because the reviewer has an access to the article as reviewed and knows the strength of the paper and can put the findings in the perspective, and it is quite educative to the readers. I don't know if I not answered, maybe on Mr. Pandurangi can clarify it. He is more experienced than me about this.
Yeah, Dr. Anand, yeah, if you can dilate
I
on
think
the
those
responsibilities. Yeah, thank you.
Yeah, those are good answers there. I would say yes. Journals do ask the authors to suggest names of reviewers. I think that is appropriate, because you are in the field, that is your area, you're investigating it, you actually know your peers who are doing similar work, or who have done the work, or who have been leaders in the field, who have published in the field, you know that. So you can certainly suggest, and then it is up to the editor to choose that. Obviously, and this part is also related to other questions about ethics. See, I mean, we would think that we are all honest investigators and that we will not cross the line, but of course that may not be reality. So when we suggest here are 3 reviewers, or whatever, 4 or 5 reviewers, we hope we are being ethical in making those suggestions, and not just choosing my friend and you scratch my back and I will scratch yours type of approach. Next time you suggest my name and I'll keep suggesting your name and you give me a good review. And no, I mean, if we are going to engage in that, the whole validity of the process itself is gone, is totally undone, and the whole field will collapse. And that's the ethics topic that I think will need a more thorough discussion, that there is a basic understanding that we are being very professional and ethical in everything we are doing with regards to writing the article, reviewing the article, publishing the article. That is understood. If someone says, what if there is a substantial number of people who are unethical or unprofessional, then the whole thing collapses. There's nothing one can do about it. We are not a policing organization. We are not investigators who go about investigating these things. We are not, CBI or FBI or something like that. We are not that. That's not our role. So if one raises the question, gee, I don't trust anybody because of all these issues, they are just, scratching each other's back, and I don't have any trust in this. Yes, these are types of accusations have been made in the field, but at the end of the day, fortunately, as of now, they remain small. I think 95% of our field remains ethical and professional. So I would say there's not a much we can do. The editors will have to take some tough decisions if, as and when they become aware of these things, and just not have such people on their review panel if they suspect any such thing is going on. The last question about using residents or postdocs or fellows and so on. I think it is appropriate to do that as long as we respect the entire process and it remains sort of blind. So this is between me and my resident and is not being advertised. The resident is, appropriately mentored that he or she cannot keep copies of this or share it with anybody and so on. And you trust the resident to do so. They have to follow your standards, and you only use people who you trust to do that. But it's okay to do it, in my opinion, because it's a good training ground. And they begin to become more critical in their way of thinking and reviewing and understanding and gaining knowledge. I think if a resident or a fellow or a postdoc contributes heavily to your review, it's very appropriate and, in my opinion, necessary to acknowledge that in print to the editor, not in the journal, to the editor. I think we should say, I was assisted by my postdoc in the review of this article, and so that it's transparent that somebody has helped you in doing that. But I don't have any objection to taking the help of residents or other fellows and so on, as long as they follow the same standards and know the rules and the do's and the don'ts that you are following.
Thank you, Anand, on that. So I think the editor would probably want to know a response to this on views of the panelists on peer review cascade, or But I would think if there is a whole lot of article journals coming under a common umbrella, I think these issues would probably arise. I mean, if each journal works on its own, I don't know if there is much opportunity.
I think I covered that. It's common practice now.
Yeah. I mean, would that, Dr. Janardhan, would that refer to if the journals are under a common umbrella? Or
generally, yes, generally under a common umbrella, but they ask you permission to do that first.
Yeah.
But it does reduce publication cost, identifying reviewers, time. I think it's acceptable to me. Whether you want to review your name or only the review, all those options are given to you by the journal. So I think you can take a call on that.
True. I mean, in this context, let's talking about the index journal in terms of the journal of the Karnataka IPS. Now, would there be a need for some kind of agreement across journals to facilitate that? I mean, it would be intuitively appear like it's probably required. Like, I mean, some kind of a stated agreement that, they probably work in the collective sense.
That's true. I mean, I think the agreement, let us say if Self-Press is publishing, many journals, and then the editor feels that this article may be more suitable for the some other sister journal, and wants to transfer the review rather than repeating the whole process. I think it's okay, but that is something that the publishers have agreed upon. It is not something that you decide in an ad hoc manner that I will give it to Indian Journal of Psychological Medicine. No, I mean, I think it's let us say if Indian Psychiatry Society and its various zones and organizations, all those local chapters, they're publishing several journals, and let us say the Indian Journal of Psychiatry doesn't want them now, whether it can give it to Karnataka Journal for publishing. But I think that happens with a mutual consent agreement right in the beginning. And I think that information is actually provided to the reviewer when the article is sent for publication. I mean, sent for review, I guess.
Sir, Ashok sir, just to mention that we had a chat with Dr. O.P. Singh regarding this, and I can say he's happy to do that. His rejection rates, I mean, IJP's rejection rate is almost 93-94%. So whether it helps the authors, I'm not sure, because from a peer review suddenly to a non-indexed journal, in a sense, indexed journal to a non-indexed journal, whether the authors will be interested, we don't know. So that option can be made available.
But that again is the author's call. If they ask you, can I send it to the Karnataka journal?
Yeah.
You can always say, no, I'm not interested, not indexed.
Yeah. So that sort of agreement we are trying to have with O.P. Singh. He's also one of our advisors for this journal. So we will keep you posted on that. Yeah, please. Thanks.
Thanks, Dr. Vijay. I mean, Dr. Kiran, I mean, how much time do we have? I was not very, there is.
We are almost done.
We are almost done. So we can have a concluding remarks from both the panelists, sir.
Yeah.
With your permission.
Sure. Dr. Anand, would you like to go first?
Oh, yeah, sure. Well, it's been, I think, a really good interaction. I appreciate that. It's been a rich discussion. One or two take-home points that I'm getting from this, and Vijay, that I think is more work for you, is to have a more formal training process. Once you have like a cadre of reviewers, make a list, maybe have about 100 potential reviewers. Then to those that are not very experienced yet and would like to take the opportunity, send out some articles for a training review. Let them review, send it back. You can send that the review of the review to some of us, and we'll be happy to comment on it and say, well, you should also have said this, you could have covered that. The tone could be that, whatever, we'll make some comments. So you are training the reviewers more formally beyond this webinar. And again, there are some very savvy, highly experienced reviewers already on your panel, so they may not need it. But there may be many novices also. I'm hoping that actually your efforts at the Karnataka Psychiatry Society's efforts at starting launching this journal will get a lot of younger people. Now, Bangalore is special because it has NIMHANS, and it presents a very skewed picture of what is there. But I don't know if you think, and maybe even Karnataka presents a somewhat skewed picture because there are so many good institutions there. But I am going to think that there are many people who are interested in being a reviewer, who have some background, who may be qualified, but who don't know exactly how to approach it. And so, so there's one take-home point. The second one is what I just would reemphasize on the question about ethics and so on. There are no straightforward answers to those types of questions. I mean, what if someone is unethical? Well, editor, if he comes to know, he takes him off the review panel. That's all one can do at this point. There's nothing more you can do. Like I said, we're not the police. We're not going to charge him with a crime or take him to court and things like that, unless it is extreme, involving money and stuff like that, which should never happen in our field. But it has happened, as you know, in the United States. There are many cases where such instances have been brought, not so much for reviewers, but for investigators. And so that whole issue of what happens if someone is stealing ideas, what happens if one is contacting the authors directly, inserting their own names, etc. That's all totally unacceptable, unethical behavior. But there are no easy solutions to that. Like, what do you do? Well, get the person out of the review panel, out of the editorial panel, maybe even out of the society, if it's extreme. So that's all I can say. Again, I have certainly enjoyed being a part of it, and thank you very much.
Thank you, sir.
Yeah. I agree with everything that Professor Pandurangi mentioned just now. I have two specific comments to make. The real problem in actually getting good reviewers in India is that you really don't have too many reviewers who themselves have an experience in research. At the most, they might have guided some, MD thesis or DNB thesis many times, and most reviewers don't have any big grants. That's the way it has been. So many of them have some appraisal skills because those things can be learned, but they themselves may not have enough experience in terms of research in the field. I think there is a real challenge. So one way to circumvent, I think, is that I think we should also think of inviting reviewers from elsewhere, but then not easy to get them because there are so many journals now. But maybe from people that we all know, people who can do favors to Karnataka Journal because they would help it grow. So we need to expand the list of viewers from just within India to, maybe even neighboring countries and elsewhere, and use your contacts to see that the reviewer base is expanded. Otherwise, my real worry is that actually you really don't have enough experts in the field to give an expert opinion on the research publication. I think that's one important thing I would like to mention. And the second one, I think, which the journal should be very aware of, which is probably not what is discussed today, but related to that, every student does a thesis, MD, DNB, MPhil, PhD, and there are requirements by Medical Council of India and various organizations to do something or the other. So you will be flooded with all MD, DNB thesis converted into articles. Now, how do you want to shift through them? Or, Vijay, this is not a small problem. This is a big problem. Okay. And then I think irrespective of who sends it, I think the journal will succeed as long as you are committed to maintaining the quality of the journal. You don't have to publish 10 original articles in an issue. Even if you publish 2 original articles and rest 2, 3 are something else, commentaries, review, that's okay. Many new journals do that. We don't have to populate our journal with too many original articles to begin with, because I think one of the reasons why so many journals come up is also accommodate so many research activities, but then all research activities may not be of high quality. I think that's something that we need to keep in mind if this journal has to attain credibility.
Thank you, Dr. Janardhan. I noticed that both in the concluding remarks, both the panelists have highlighted something, and that's come through in the ongoing comments as well, the need for building some kind of a training process for peer reviewers and to make that system increasingly robust. And there have been some very specific suggestions made, and I think that's probably a key highlight of today's panel discussion. With this, I hand over to moderator Dr. Kiran Kumar. It's been a very enjoyable session. Thank you, Dr. Kiran.
Thank you, sir. Thank you for being the chair. Now, the whole process would not have been possible if not for the active participation and encouragement from the office bearers of IPS-KC and the journal committee. We have with us the General's Honorary Secretary of IPS-KC, Dr. Somsekhar Bijal. I invite upon Dr. Somsekhar for the vote of thanks. Over to you, Dr. Somsekhar.
Thank you, Dr. Kiran. It was a wonderful session. I'm particularly, personally, I'm very much happy that the long dream, what Dr. M.A. Ashok sir had to have Karnataka, its own journal, is coming true, this dream after almost 20 years. And I thank all the members of the August Indian Psychiatry Society Karnataka chapter for agreeing for this new project. And when we planned for having our own journal, myself and Vijay Arbisetter and also the many advisors like Swaminathan sir, Ashok sir, everybody has told about what needs to be taken. These are the basic things which need to be inculcated so that we can prepare ourselves for the coming, what will be the possible problems we can arises in the future, how we can get prepared ourselves. So one among them is ethics, as well as the second one will be the peer review processes, identifying the peer reviewers. Actually, we even had a plan of having this in-person platform. In the future coming days, we would like to have how to write up the manuscript, how to, for the new authors who want to write a papers, that manuscript writing workshops, as well as the peer reviewers workshops we would like to conduct in person in the future coming days. So I remember spending few hours with Dr. Anand Pandurangi when he had made his visit to Demans, the Harvard, around in 2016-17, I remember. So whenever Dr. Anand Pandurangi makes another visit to India, we request him to give us some time so that we can have in person some training programs to all of our members. And I would like to thank Dr. Anand Pandurangi for being with us on this day and giving us a few tips on the peer review processes. Thank you very much, sir. On behalf of Indian Psychiatry Society Karnataka chapter, I would like to also thank my teacher and Dr. Janardhan Reddy, sir, for giving us the basics of the peer reviews, what do's and don'ts the peer reviewer should have it, and what are the important aspects which involves in the reviewing process. So thank you very much, sir, Dr. Reddy, sir. And also I thank Dr. Ashok Mysore, sir, who is also another my teacher, for chairing this session. And I thank the editor, it is very, very important, Dr. Vijay Arvishetar, whom he has taken a very, in the given short notices and short time, is making the things always moving on. So I thank Vijay Arvishetar and also the deputy editor, Dr. Kishore, and all the editorial team, and also all the participants who have given their valuable inputs, also participated in this program, especially to Dr. Matthew, sir, is there. Thank you very much, sir. Thank you, one and all. With this, I would like to hand over to moderator, Dr. Kiran, for the closing remarks.
Thank you, sir. Thank you all. It was a wonderful session. In fact, all of us, it's a learning experience for the young editorial team. We are quite anxious about the whole process. So hopefully we'll get a lot of insight and a lot of courage from these exercises that we have been doing. It was wonderful to have all of you. Thank you again for making this event a success. So we'll close this session. Thank you very much, sir.
Thank you.
Thank you.
Dr.